The TOPS system for degenerative spondylolisthesis and spinal stenosis is the only clinically validated facet replacement device that stabilizes the spine while preserving motion, offering an alternative to spinal fusion. To ensure optimal performance and longevity, proper patient positioning on the operating table is essential. This video demonstrates how correct positioning optimizes outcomes and highlights the risks of improper positioning. For the best results, patients should be positioned neutrally on the table as though they are standing. A slight flexion position is even preferable. Adding abdominal support is important to prevent iatrogenic segmental hyperlordosis when the facets are removed. At the core of the TOPS device are two spherical elements that slide against each other. Remember, TOPS is not a spring or a tether. It conforms to the patient's movement and preserves physiologic facet motion. Proper positioning ensures optimal contact between these articulating elements. What happens when positioning is incorrect? If patients are placed in excessive lordosis on the table, the implant will open into a flexed position when they stand. This shifts the implant's neutral position, reducing the articulating contact area by approximately 50%. This intraoperative image shows the implant with optimal contact, which seems to be placed correctly. But look at this post-operative image of the same patient when he stands. It reveals a much smaller contact area, resulting from excessive lordosis during surgery. Why does this matter? With less surface area absorbing the same shear force, half of the implant's contact area remains unused, while the other half endures twice the stress. Over time, this imbalance can accelerate wear and shorten the lifespan of the implant. In summary, ensure the patient is positioned in a slight flexion position before skin incision to maximize implant longevity and reduce complications. The simplest solution for patient positioning is to use a Wilson frame to place your patient in slight flexion, as you would for a traditional laminectomy procedure. If you use a Jackson table, you can drop the patient's legs to create slight bending at the hips. Finally, remember to avoid segmental lordosis created by the facetectomy by padding to support the patient's hips, thighs, and sides. Following these principles promote the best possible outcomes for your patients.